Hi, Sean. My name's Erin. I'm going to be your nurse today. I see that another nurse has already come and taken your vitals. It looks like your blood pressure, heart rate, and respirations are a little bit high, but your temperature is normal and your oxygen saturation is normal. I believe that they're probably high because you're experiencing some pain, and we'll do a further assessment from there. I'm going to ask you some questions if you don't mind. Just answer as best as you can. Are you experiencing any shortness of breath?
No.
You mentioned you are already having chest pain and abdominal pain. Do you have a history of any cardiac issues, hypertension, or high cholesterol?
High cholesterol and blood pressure I take meds for.
Okay, perfect. Do you have a history of vertigo? Are you having any dizziness?
No.
Okay. Are you a smoker?
Nope.
Have you had any swelling in your legs or ankles lately?
No.
No, I'm going to do an assessment of that in just a second. First, I'm going to check your pulses. Can I have your arms, please? Okay, so I'm just checking the radial pulse, and it's equal. I'm checking the brachial pulse, and it's equal. I'm checking the carotid pulse on either side, one at a time, not at the same time. I don't feel any pulse deficits right now. I'm also going to be checking for some swelling. Stay there. So I don't see any swelling in his legs right now, just pulling his pant legs up. Does this hurt? Is there any discomfort?
No.
Okay, good. Thank you. I'm checking for dorsipedis pulses. They're equal. Cap refill, less than 3 seconds. Okay, Sean, I would like to listen to your heart and abdomen, if that's okay.
Yes.
Okay, perfect. Can I just have you lift your shirt up for me? Perfect. So using the diaphragm of my stethoscope, I'm going to be listening to his pulse points on his chest. So we have apical, pulmonic, tricuspid, Erb's point, mitral. The mitral is also where I would be listening for the apical pulse. Typically, I listen for the apical pulse if I have felt any sort of pulse deficit or if the patient is taking any cardiac medications. I'm now going to flip over to the bell side of my stethoscope, and I'm going to listen again. Apical, pulmonic, tricuspid, Erb's point, and mitral is really where I'm listening the most. I'm listening for S3 and S4 sounds like murmurs that sound like whooshing sounds or swishing sounds. I'm now going to listen to his abdomen, again with the diaphragm. Starting in the right lower quadrant, typically I would listen for 1 full minute, but obviously there's not enough time for that here. Right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. While I'm doing so, I'm also looking at his chest and abdomen. I don't see any work of breathing. Color is fine. Umbilicus is midline. I don't see any lumps, bumps, rashes, or lesions. Next, I'm going to be doing percussion. So the appropriate way to do percussion, I'm going to be putting my middle finger onto the patient, and I'm going to be tapping with the middle finger of the other hand, and I'm listening for dullness and tympany. I will start in the left lower quadrant, which is the farthest away from the pain. So listening here. So I do hear some dullness over the liver. The rest of it is tympanic. Next, I am going to be doing some palpation. So the proper palpation technique is I'm going to spread my fingers a little bit to get down past the adipose tissue. Again, starting in the left lower quadrant, I'm feeling for lumps, bumps, if the patient's having any pain, and if I feel any swelling. So starting here, no pain, no pain. A little bit of wincing here, a little bit of wincing here. So I do have some wincing in the both upper quadrants, which is expected considering he mentioned he has epigastric pain. I'll have you pull your shirt back down now. I'm going to just give a call to the doctor to let them know what's going on. Let me just see if I've forgotten anything. Nope, I'm good. So ring, ring.
Dr. Jones.
Hi, doctor. My name's Erin. I'm calling from X Hospital. I have a patient with me here, a 67-year-old female presenting with chest and abdominal pain, upper gastric epigastric pain. The patient has a history of type 2 diabetes, hypertension, hyperlipidemia, osteoporosis. The assessment, I didn't feel any pulse deficits. The vital signs were elevated. Blood pressure was high. Respirations were high, and pulse rate was high. The patient doesn't seem to be having any shortness of breath, denies history of shortness of breath as well. The patient is on inspection. Patient has normal color, no lumps, bumps, or lesions. On palpation, there's some rebound tenderness kind of thing up in the epigastric area. Auscultation, bowel sounds were fine. S1 and S2 are heard throughout all pulse points. S3 and S4 were tested. I don't hear any murmurs that sound like swishing sounds in the Erb's point or mitral areas. Nothing on palpation. The patient, I believe, is having an atypical MI. I think that we should be ordering a chest x-ray, a ECG, continuous cardiac monitoring, and some blood work, including troponin, and then a repeat troponin in 1 hour. And I believe that the patient needs an assessment from the doctor right away. Any questions, just let me know. Thanks.